A public health specialist is calling for greater collaboration to address critical health issues affecting the population. The issue was raised at a recent business seminar at the University of Technology's Western Campus.
Despite policies by lawmakers, statistics reveal that many Jamaicans remain unaware of non-communicable disease (NCD) status. According to the Jamaica Health and Lifestyle Survey 2016-2017, more than half of Jamaica's population suffers from pre-obesity, 2/3 have elevated blood pressure, and 1/8 have diabetes, while a quarter suffers from pre-diabetes. Just under a fifth have cholesterol, and 4/10 of persons with hypertension or diabetes are unaware of their condition. And for those who are aware, under 30% are under control. It is against this backdrop calls are growing for a collaborative effort to enforce effective implementation.
The bigger picture is that our health affects productivity, and productivity affects development. If we have a healthy population, we will have a stronger workforce. We'll have reduced healthcare costs. We'll have improved quality of life.
Speaking at a business seminar at the University of Technology Western Campus Wednesday, public health specialist Dr. Marcia Johnson Campbell contends that while the problem is complex, the Ministry of Health alone cannot achieve this.
We may even go ahead and make the policies, but if it is not implemented, if it is not enforced, it fails. The tobacco regulations still have not been effectively enforced. And everywhere you go, even though it is prohibited by law to be smoking in public places, to be smoking in places close to where children are going to be active, it still happens and nobody does anything about it. Research without application stalls.
It is why she's calling for greater collaboration to implement enforcement.
The Ministry of Health and the regional health authorities from the public sector, working with industry employers and insurers in the private sector, with the research, innovation, and training coming from academia, and in the community, civil society, our citizens, you, students, academic staff, you, every one of us have to be working together.
Antonia Atkinson, TVJ News.
Portland is set to benefit from improved patient care as much-needed hospital beds are being added to the Port Antonio Hospital thanks to a collaborative effort by several charitable organizations. Sandy Williams reports.
2 new beds have officially been handed over to the Port Antonio Hospital, marking the first phase of a broader donation initiative aimed at strengthening healthcare delivery in the parish. The donation comes through a partnership involving multiple foundations, including the Pennant Hill Foundation.
In partnership with Miyasaka Foundation and the CEO, Carol Pickard, as well as the Guide Outreach Foundation, and Neil Phillips is probably known to this hospital because they have in the past donated. But these foundations have all combined together, as well as the Ashe Foundation, and they're out of Los Angeles. I just want to say all these foundations are working together to ensure that the vision to, changing out the beds, improving the equipment, medical supplies.
Those medical supplies include foot covers, cover-ups, disposable surgical gloves and masks, nebulizers with ear entrapment, and towel drapes, among other things. Officials say this is just the beginning, with 10 additional beds expected soon. The Port Antonio Hospital has long faced limitations in bed capacity, often impacting the level of care that can be provided to patients. Stakeholders say the additional beds will help to ease some of that pressure.
If we can lessen the need for the citizens and those who use the hospital, some of the smaller things, especially when it comes to medical care, is very expensive. The vision is that we can have our own MRI machine and our own X-ray machines, even if some of these machines are portable.
With more beds on the way, hospital administrators are optimistic that the added resources will significantly enhance patient care and overall operations.
It is not going to be an overnight process. It's going to take time, but it's the vision that you have to improve the system starting from last year. I am overly very impressed. And I'm certain that within the next 2 years or so, we are going to see big improvement in this hospital.
Sandy Williams, TVJ News.
It's time for a break here on the Midday News, but stay with us, more stories when we return. Welcome back to the Midday News. It is now time for the Business Minute. President and CEO of the Cygnus Group, Beresford Gray, says the company is exploring partnerships with the private pension industry to help finance infrastructure development. He noted that pension funds held investments valued at some $847 billion last year, which could be tapped to support major projects. The move comes in the wake of widespread infrastructure damage caused by Hurricane Melissa, estimated at $1.4 trillion. It also follows the government's decision to allow private pension funds to increase their exposure to private equity investments. Further afield, just ahead of the start of the Easter weekend travel weekend, U.S. gas prices has risen another 2 cents to an average of $4.08 a gallon. Prices have increased all but 3 days now since March 1st. Since March 2nd, there has been a $1.08 spike in gas prices. That's the biggest one-month climb besides the time after Hurricane Katrina in 2005 or the sanctions placed on Russia after its invasion of Ukraine in 2022. And that's it for the Business Minute. Time now for the top stories from around the world.
The stage is being set for the holding of general elections in Antigua and Barbuda following the dissolution of Parliament yesterday by Prime Minister Gaston Brown. Prime Minister Brown indicated that he will instruct the Governor General when to issue the right of election, with Antiguans to head to the polls 21 days afterwards. At the last general election held on January 18, 2023, the ABLP secured 9 of the 17 seats, with the remaining seats going to the UPP and 1 independent candidate.
And we head to our final break. When we come back, we'll have your Midday Sports Report.